This is Dr. Stephanie Crawford Getz, the Director of Mental Health for Douglas County School District Personalized Learning Department. Today we're going to learn about keeping students safe. Remember, it's everyone's responsibility. Safety is Douglas County School District's #1 priority. Our goal is to maximize the safety for students, staff, and the community. Do you know the warning signs that a student may be planning something dangerous, either to themselves or others? Do you know how to get that student help? This training will teach specific warning signs and invitations you may observe in your students, as well as the process for making sure everyone stays safe. Safety is everyone's responsibility. School staff can be a vital part of the prevention effort. Staff have daily contact with students. Staff have an ethical responsibility to keep students safe. We need all eyes on all kids all the time. No matter your role in our district, you are in a key position to know the students you interact with on a daily basis and help identify those who may have safety concerns. Now we are going to learn about the warning signs and invitations that students may display. Students may make statements that they do not want to or expect to live, such as, "You won't see me next week," "I can't keep dealing with this," "I just want to die," "I just want it all to stop." They might also make statements that indicate they may hurt someone else, such as, "You, they, he, she will be sorry. I'm going to kill, shoot, or hurt someone." There is no one profile of students at risk. We need to focus on behaviors and statements that students demonstrate. These behaviors and statements are invitations for someone to help them. These are the suicide warning signs and invitations to be aware of with your students. Previous attempts or behaviors such as ideation, planning. The more detail, the higher the risk. Preoccupation with death, making final arrangements, giving away belongings, changes in behavior, appearance, thoughts, or feelings, withdrawal from activities, friends, and other events, external triggers, such as a breakup with a boyfriend or a girlfriend, the death of someone close to them, or another perceived or actual loss. Whether a student states or shows an invitation once or repeatedly, each statement and concern always needs to be reported to a mental health professional immediately. Your goal is to keep students safe by getting them to a mental health professional. Mental health professionals will assess the student for safety and determine the next steps. These are the threat warning signs to be aware of with your students. Previous threat attempts or behaviors, attempts to intimidate or frighten others, gesturing or saying threatening comments, planning, again, the more detail, the higher the risk, preoccupation with weapons or violence, testing boundaries, changes in behavior, appearance, thoughts, or feelings, and external triggers, such as perception of being wronged by others or negative peer and/or adult relationships. Whether a student states or shows an invitation once or repeatedly, each statement and concern always needs to be reported to a mental health professional immediately. Your job is to keep students safe by getting them to a mental health professional. Mental health professionals will assess the student for safety and determine next steps. There are common issues that your students might have. They might feel a sense of hopelessness, desperation, or despair. Does not see self as having support by a trusted adult. Has been bullied or perceives self as having been bullied. These are the underlying issues that may lead to a student showing direct warning signs and invitations for help. If we are aware that a student has these issues, we want to begin to support that student proactively. Think about a first step you might take to support a student with each instance. In all of these cases, you can refer the student to a mental health professional. The mental health professional can help the student have a turning point to thinking about positive future events and assist in getting counseling. A student may be assigned a mentor. Mental health can work with administration to determine if bullying has occurred and also to provide resources and support. Our goal is to intervene early. If you encounter a student at risk, stay with the student. Do not leave them alone. Do not promise confidentiality. Express authentic concern. Call or send for adult support. Immediately access the person in the building who is trained in suicide or threat assessment and intervention. So again, here are the do's. Stay with that student. We do not want students left alone if there are safety concerns. Immediately inform a mental health staff or administrator. Do not wait for a break or until the end of the day. Mental health staff need time to assess the student and notify parents or their guardians. Here are some sample statements that you can say when you're with a student who is in need. I am here to help you and I care about you. I can see that you are upset and I'm here to help you. I can't promise not to tell. I want to get you the help that you need. These are the people in your building who are trained to help. Administration, counselors, your social worker, school psychologist, school resource officer, and your school nurse. Remember to identify who these trained people are in your building and how to access them. Find out where they can be found in the building and what days they are in your school. Remember, keeping students safe is a team approach. Everyone plays a role. School staff, parents, and outside service providers all need to work together. All mental health professionals must arrange with a nearby mental health professional to cover when they are out of your building. They let their backup know when they are gone. The building administration and front office staff must know who the backup is and how to contact that person. This is particularly important at the elementary level when you may have just either a school psychologist or a social worker as your mental health provider. There are two separate processes that we use when we're assessing for either suicidal concerns or threat towards others. There can be a high correlation between suicidal thoughts and thoughts about hurting others. When we assess for one, we also screen for the other. Both of these assessments are done to keep students safe. The hopeful outcome of these is for the school to collaborate and team with the student and their parents to develop a safety plan and move forward positively. Now we are going to review resources that you, your students, and the community can use. Text-a-Tip is offered by the Douglas County Sheriff's Office in partnership with local police departments in our district. Anyone can use the Text-a-Tip link or app, including students, staff members, neighbors, church members, and anyone else in the community so that they can tell law enforcement immediately and anonymously. Please watch the video to see how this resource is used in our schools.
The Text-a-Tip program is an awesome program. It allows students to anonymously text in a tip, range from concerns about other students, whether the student is possibly suicidal or depressed, students possibly under the influence of drugs or alcohol.
I think it's great that we have Text-a-Tip. I used Text-a-Tip and I was just feeling uncomfortable about things that were going on around the school, so I decided to let the school know what was going on just so I could feel safe about everything while remaining anonymous.
It's nice knowing that if something happens to me or if there's an issue, I can remain anonymous, but the issue still gets resolved and we're safe in the end.
The Text-a-Tip program receives approximately 400 Text-a-Tips throughout the school year, and so far we've actually saved 16 lives.
I have a couple friends that have actually used Text-a-Tip on several different occasions, and I know that every time they've had to use it, it's been resolved without much further issues. So it's really nice to know that we have something like that, a program that can take care of things anonymously and quickly.
What it does is it allows us to bring attention to that student so that we can address that situation properly.
Another great resource is Safe to Tell. Safe to Tell is a state resource. It provides an anonymous venue for parents, students, teachers, school administrators, and law enforcement to share information. People can call the phone number or make a tip by visiting the site. Colorado Crisis Services is another great resource in which services are confidential. People can call or text for help. When people call or text, the staff will listen and help them get the support they need. They also have walk-in clinics in which people can visit for free. Once an individual visits the clinic, their staff will assess for safety and help that person find services that work with their insurance and their income. So remember, you can call 1-844-493-8255 or text TALK to 38255. If you would like to take additional trainings to learn about common mental health issues, how to be suicide alert, and how to get students to a helping professional, you can register for Safe Talk, which is provided by Phyllis Harvey through the Douglas County Sheriff's Department and it is also provided through our Douglas County School District's Personalized Learning Department. Another great resource is the Colorado School Safety Resource Center. I provided the link for you to explore what's available and sign up for their free trainings. At the beginning of this training, I asked, do you know the warning signs that a student may be planning something dangerous, either to themselves or others? I also asked, do you know how to get that student help? Now that you have taken the training, you should be able to answer both of these key questions. If you have additional questions, ask your school psychologist or social worker at your building. At the beginning of the school year, all schools and departments will be meeting their counselors, school psychologists, and social workers. During this time, you will learn where to locate them and what days they are at their schools. This is the perfect time to ask further questions about safety and any questions you have about this training. If you are not in a school, someone from the district mental health team will be meeting with your department.